I'm Michael Thorpy, and I'm at Montefiore Medical Center in the Bronx, and in the Department of Neurology. I'm Professor of Neurology at Albert Einstein College of Medicine. And I first got involved in sleep in 1980. And I had just completed a neurology residency, and I was looking for a fellowship position in neuroendocrinology. I had a particular interest in neuroendocrinology. I was had for many years had an interest in the hypothalamus and pituitary tumors, and so back actually in 1979 and early 1980, I was looking for a position somewhere where I could do a neuroendocrinology fellowship. I particularly wanted to work with somebody because I didn't want to just go somewhere and sort of start off thinking about neuroendocrinology. So I looked around. There were a couple of opportunities that I had. One was at the Mayo Clinic at Rochester, and they wanted me to come there to develop a neuroendocrinology program. They didn't have one, but they wanted somebody to combine the neurosurgeons, the neurologists, the endocrinologists together to develop a neuroendocrine program. That was not really what I wanted to do. I wanted to work under somebody who was in the field. The other opportunity I had was at Montefiore Medical Center with Dr. Elliot Weitzman. And I went down and interviewed with Elliot, and at that time, Elliot had a very large grant studying chronophysiology, and he had developed what was called the Laboratory of Human Chronophysiology at Montefiore, where people were studied in time isolation. And when I went to interview him, he was extremely busy. He in his office, his phone was ringing all the time, and one minute it was the New York Times or the BBC, or there was so much going on because there's a lot of interest in this time isolation facility that he had. So it seemed very exciting. There was so much going on, and and he offered me this neuroendocrine position to work with the endocrinologist, and he was doing studies in endocrinology and time isolation. So I joined with him, and at that time, Charles Seisler was working with Elliot in this Laboratory of Human Chronophysiology at Montefiore. And so I got involved in that and was assisting. We had subjects in time isolation for as long as 6 months. And we were drawing blood samples every 20 minutes for up to 6 months. We would take tiny aliquots of blood to measure for cortisol or growth hormone. So it was a very exciting environment. And at that time, Elliot had a sleep disorder center at Montefiore. It was the first accredited sleep disorder center in the country, accredited in 1977. It wasn't the first sleep center in the country. I think the first would have been at Stanford with Bill Dement. But Elliot had done some training with Bill Dement in sleep and came back and created a sleep center. And so I was working partially with the Lab of Human Chronophysiology, Chuck and Elliot, and but also at the Sleep Disorder Center. And I got involved in sleep, and I suddenly found this area of sleep which I knew nothing about at that time because, at that time no one had ever been educated in sleep at medical school or in residency. So it was all new to me, and it was all very exciting. And so I got more and more involved with the Sleep Disorder Center at Montefiore and enjoyed seeing lots of patients there. And so after a 2-year neuroendocrine fellowship working in the Human Chronophysiology Lab and in the Sleep Center, Elliot actually left Montefiore and went to New York Hospital and developed a new lab up in Westchester County, just north of New York City. And I had the opportunity of running the Sleep Disorder Center at that time because I was so actively involved in it. So So I took over the directorship of the Sleep Disorder Center, Sleep-Wake Disorder Center at Montefiore Medical Center. That was back in 92, and have been essentially full-time in the area of sleep medicine since that time. Yeah, Elliot was a great person, and I'm sorry that people aren't around to be, he's not around for people to be able to meet him and learn from him. Very smart person, intelligent person, and very good educator. He was sort of tough. He didn't sort of stand for anything that wasn't either accurate or portrayed correctly. He was very, very smart. And it was interesting, back at that time, the first sleep meeting I went to was in 1981. It was in Cape Cod. And at that time, really the two greats in sleep were Elliot Weitzman and Bill Dement. And, being on each side of the country, they sort of both had sort of some conflicts. So it would be very entertaining at the meetings, the backwards and forwards interaction between Elliot and Bill Dement. And there are other people, Helmut Schmidt, of course, and John Karachan were also sort of prominent people in the field at that time. But all the whole sleep society at that time could fit into one relatively small room. There were very few people involved. But Elliot, I remember one of his sayings that he said was that it's not important to ask questions, it's important to ask the right question. And that always sort of stuck with me with Elliot, and that was typically Elliot. He had this innate ability to look through studies and data and really pick out the most important element that everybody else seemed to have missed. And he would bring up something and everybody wondered, well, why didn't they see that or couldn't recognize it? He had that ability to recognize the important elements of almost any research study. But his main contributions to the field were really with cortisol. He was the first to describe the episodic nature of cortisol and its relationship with the sleep-wake cycle. So that was a major contribution from Elliot to the field. But of course, he did a lot on entrainment and non-entrainment of subjects in the lab of human chronophysiology. So a lot of good work came out of that. Again, my first involvement was as a fellow joining the Association of Sleep Disorder Centers back at that time, and going to that first meeting that I went to in 1981 in Cape Cod. And then I got more involved. I mean, at that time, as I say, there were not a lot of people involved in sleep. And so at the time that I got involved in the Association of Sleep Disorder Centers, there weren't a lot of people that were actively involved in the organization itself. And so because sleep was a new developing field, and I found it extremely exciting because it was so little known at that time, that I got involved in various committees and I got involved in the accreditation process, and I know I did a huge number of accreditation visits over the years so saw sleep disorder centers all over the country that were starting up and developing, and so that was interesting to meet people in the field and visit centers and see how other people were doing things. So my time on the accreditation committee really helped a lot in understanding, the direction of sleep medicine. Then I got involved with the diagnostic classification of sleep disorders. I remember Bill Dement coming up and asking me if I would take that on, and so I thought that was exciting to try to create a new type of classification. And at that time, I'd met a number of people from around the world and various parts of the world that were interested in classification. And so the idea of creating an international classification of sleep disorders arose, because the earlier edition of the classification was developed in 1979, and it was published in the journal Sleep, and it was really an American classification system for sleep disorders. And a lot of people in other countries, particularly Asia, Japan, and Europe, had sort of different views on diagnosis of sleep disorders at that time. So the challenge of trying to pull people together to create an international classification that everyone could agree upon really appealed to me. So I got involved in that. I didn't realize that it would really consume 5 years of my life, and it really did. I mean, it's got to the point where it was almost pathological, where I'd be taking my children to sports and sitting in the car proofing articles, and every spare minute I had, I'd be proofing documentations that came from Europe or came from Asia. We're trying to meld them together into a classification that everybody could agree upon. And so there were numerous meetings at that time internationally in Japan and in Europe to get everybody on board. And eventually it was successful. We were able to produce the first international classification of sleep disorders that not everybody agreed with every word of it, but everybody in essence agreed that this was a first start for an international classification. So that was a very rewarding process that the American Sleep Disorders Association sort of initiated and developed at that time. Yeah, I mean, the main thing was really to let everybody sort of have their say and get their ideas for a start. I mean, the most important thing was sort of not coming in sort of strong with our views in America, which were somewhat different, for example, to the Japanese. There was a major figure in sleep medicine in Japan, Yutaka Honda, who was very much involved in classification, had his ideas on classification, particularly with regards to narcolepsy, and had different views on that. And but through group meetings on a number of occasions and very collegial meetings where we would get together and discuss classification, we were able to come to a consensus as to which direction to go. And the same happened in Europe too. And so it was just a matter of letting everyone sort of have their say and assessing their views and then trying to reach a consensus, which we were able to do. Most of them were fairly rudimentary. I mean, they were two-bed labs that were starting up. But the accreditation process demanded high standards, and we would meet with the hospital administrators. And in most cases, of course, the hospital administrators knew very little about sleep or what it was about, because it was such early days in sleep medicine. But fortunately, the people who were wanting to work in the sleep centers and were enthusiastic about what they were doing, and were able to convince their administrative structure that this was an important part of hospital practice. Most of the ones that I visited at that time were hospital-based practices. I mean, sort of individual sort of private labs sort of developed to a greater extent anyway after that. But yeah, it was an interesting process. I remember one site visit I went to, have one recollection of an interesting event that happened. We were visiting the sleep center at night, watching the studies being performed. And then all of a sudden, while I was talking with the director of the center, the technician came rushing in with an ashen-looking face, and said that a patient had just had a generalized seizure in the bed. And so we, the director and I, went back to the room to see this person and to help them out. And we found that this was a patient that had been referred into the lab for a study, and they didn't really have much in the way of medical information on the patient. And so it was extremely embarrassing for the director of the sleep lab that here was this emergency happening in the lab at night in a patient that they knew nothing about. And for that, part of that reason, I mean, we always had the policy at Montefiore that we would never study anyone that an individual associated with the sleep center had not seen and knew medically. And that sort of reinforced that attitude of mine. And so to this day, we never have patients referred in by an outside physician that we have not had direct contact with. They all have to be seen by somebody in the sleep disorder center. And that certainly reinforced it. And I think probably reinforced it for that medical director from there going forward. Well, I was actively involved in one stage in practice parameters. We could see that we needed to develop practice parameters where everyone was on the same page with how we were going to address things. So that I was, for a number of years, I was very active in developing practice parameters for the association, and that was very rewarding activity too. And so with the practice parameters, accreditation, the classification, I was really sort of quite busy with association activities around that time. Oh yeah, I mean, my involvement with the association had a major part to play in how I ran our practice, and it helped reinforce in me the importance of having good standards and principles, and how to manage patients, and of course the advantage of doing many accreditation visits was that each time you would go somewhere, you would pick up some little piece of information that would be helpful for me that I could take back and utilize in our lab. And so I had that opportunity to be able to incorporate information from a wide variety of sources that was very useful, and so helped set the standards that we developed at Montefiore in our sleep center. Well, narcolepsy was an area of particular interest at Montefiore. And Elliot Weitzman had a very strong interest in narcolepsy, and so we had quite a population of patients with narcolepsy, and from the greater New York City area. And I found that to be obviously a very fascinating sleep disorder, and so we used to try to get as much information. I remember back in those days, our standard routine for evaluation of patients was that a patient would be seen, a new patient would be seen for an hour by a physician, an hour and a half by a psychologist, and then typically would undergo 2 nights of polysomnography with a multiple sleep latency test in between. And that was pretty much the routine for every patient that we saw. And of course, you can't do that these days. But back then, we did it in part because, there was still a lot that was unknown back in those days. And so the more information we could get on every patient, whether it was a patient with parasomnia, sleep apnea, insomnia, or narcolepsy, the more information we could get, the more we could learn about sleep medicine and sleep disorders. So we studied patients very intensively, and as a result, we learned a lot, and our population of patients with narcolepsy has built up over the years to the point now that we have a large population of patients with the disorder. Well, when I joined the Sleep Disorder Center at that time, the other people that were actively involved were Charles Pollock, who is since deceased, and Arthur Spielman, who also unfortunately is deceased. And so they were great mentors for me, and they were involved in sleep medicine before me, and Art, being a psychologist, was extremely helpful for me to learn about the psychology of sleep medicine, and he was a great person to work with. The other person was Daniel Wagner, who I'm not sure, but I think may be deceased now too, and unfortunately most of those individuals have passed on. But there were a number of people that had worked at the Sleep Disorders Center at Montefiore, Howard Rothwag, for example. And so, having the opportunity to meet with these leaders in the field who knew so much more than I would ever know about sleep medicine was very exciting, and I certainly learnt a huge amount from them. I think the organization has been able to bring together a sort of a loose network of sleep medicine physicians who had an interest in various aspects of sleep. Some people just interested in sleep apnea, for example, others interested in narcolepsy, others interested in insomnia. And people back in those early days in 1980 was doing a lot of things their own way and in an uncoordinated sort of fashion. Everyone was doing something sort of differently. And I think the organization has been really good to help develop standards and of practice that have been able to unify the field and bring everyone together. And of course, to be able to promote a venue for people to be able to exchange ideas. And when you get people together at annual meetings, such as the Sleep Meeting 2023, people meet together and their enthusiasm grows. And everybody really that leaves one of these organization meetings is sort of more enthusiastic when they leave than before they arrived about sleep medicine in the future. We all recognize that it's not a field where there's sort of an end to the knowledge base. There's such a huge amount that's unknown, and we're all excited about that when we see new advances. And that ability of the organization to pull people together to exchange ideas and help foster research and improvements in clinical practice, I think, is the greatest benefit of the organization. Yeah, I think the thing about Elliot was that Elliot was really, I believe, was absolutely brilliant. He was an extremely smart individual, and he really had the ability to cut through extraneous information and get to the most important parts of information. And I'm sorry people didn't get to meet him for that reason, because every meeting that Elliot went to, he sort of stood out as somebody who everyone looked up to and respected and valued his opinion, and was rarely ever wrong on anything. He just had that ability to succinctly understand where things were going from sleep research and clinical practice. That he was really a tour de force in the sleep field that unfortunately people haven't had the opportunity to see. When I joined Montefiore, the lead technician in the sleep disorder center was Peter McGregor. And Peter had been with Elliot for many years. In fact, had done some monkey research with Elliot in Albert Einstein prior to their developing the Sleep Disorder Center at Montefiore. But Peter was a great person, a wonderful personality, very pleasant. Everyone that met Peter loved Peter because he was so pleasant and interactive with people. And anyway, Peter really taught me a lot about polysomnography, and he really paid attention and was greatly interested in polysomnographic techniques, and he became a leader in the field of polysomnography technologists, and many of the technologists wanted to work with Peter because they enjoyed him as a person, but also for his abilities as a sleep technologist. And unfortunately, Peter has since passed away, but he again was a great force for the technological aspects of sleep medicine. AASM is an organization that brings together people from around the world, really, and that have similar enthusiasm and interest in sleep medicine, whether it be in research or in clinical work, but brings people together in a way that people learn through the experience of meeting with others, and this enhances their professional and academic careers in sleep medicine.